Okay, good. Thank you so much. And welcome to our EHY conference, UIH conference. And I'm a professor in chemical engineering, and I joined Cornell not long ago. So if you have any questions about a career in STEM or the career path as a professor, feel free to ask these questions at the end of this discussion. So today I wanted to share with you a little bit about the research that has been going on in my group, and it has to do with polymers. And I wanted to show you how we use the polymers to treat infections, although it's not the type of infections that is going on around the world right now. We mostly focus on bacteria and bacterial infections, and these are organisms that are slightly larger than the coronavirus, on the order of about 1 micron on average. And let's start with polymers. So maybe the word polymer is unfamiliar to a lot of you, but you must have seen it because it's so ubiquitous in our life. So here are a few examples. Tires and Tupperwares and baby diapers, these are all things around us that are made almost entirely of polymers. And polymer has another name, has a lot of other names. They're better known as plastics or rubber. And even Boeing's newest airplane has more than 50% of its weight made of polymers. And in research in my lab, we try to push that boundary of applications of polymers into new areas. For example, we have made polymers into membranes, and these are paper-like sheets that you can use to separate molecules based on their size or charge or other characteristics like hydrophilicity, which is the description of how much the molecule likes water versus oil. And a lot of polymers or plastics have been made to be conductive. That is really amazing because then that enables the fabrication of flexible electronics. So a lot of the wearable and implantable electronic devices, for example, like a implantable sensor for glucose for diabetes patients, is only possible because of these conductive polymers. And perhaps most surprising of all is that we have been eating a lot of polymers. And I'm sure many of you have the experience of taking a pill that says it has sustained release effect, or it remains effective over 48 hours. And these are all pills that are made almost entirely of polymers. It's the polymer matrix that slows down the diffusion of drug molecules and sustain that release, that presence of therapeutics in your body for days. And we're going to talk more about the drug delivery aspect of polymer application later in this talk. But before we delve in, what are polymers exactly? How do the molecular structure look like? So here is a cartoon representation of polymer. So poly means many, and mer means unit. So polymers are these really long molecules that are made of many, many repeat units. And one of the most common polymers that we encounter is called polyethylene. And if you ever used a squirt bottle in the lab or at home, that's commonly made of polyethylene. And this is the molecular structure of polyethylene. And within this red circle here is the repeat unit of polyethylene. It's a very simple repeat unit. It only has 2 carbons and 4 hydrogens. And to make a polyethylene molecule, these repeat units are present one after another, all linked together to make this polymer with the molecular weight of hundreds and thousands of kilodalton. And when I was at your age, polymers really fascinated me because precisely of the repeat units. Because what this means is that you could change the repeat unit ever so slightly, and that small change gets magnified by these hundreds and thousands of repeat units. And the small change that you make on the molecular level, really on the angstrom level that you would never be able to see, after this magnification, become changes in features and properties that you can touch and feel. So that to me is what's most attractive about polymers. And being a polymer scientist, that sense of molecular design with the end application and the end properties in mind is quite unique. And this is in stark contrast to, for example, small molecules like water and ethanol. Their molecular structures are completely different, but on the grand scheme of things, you know, if you take a glass of water and a glass of ethanol, it's kind of hard to tell them apart. So here is, we're going to use ethylene, polyethylene as an example. So if you look at this repeat unit, again, we have 2 carbons and 4 hydrogens. And if you simply replace one of these 4 hydrogens with chlorine, then we get PVC. Many of you might be familiar with this acronym. It stands for polyvinyl chloride. And instead of being this flexible and soft material that can be made into squirt bottles, PVC is very hard and durable. And we even make houses out of this plastic, simply just by replacing 1 hydrogen with a chlorine. And if instead we replace that 1 hydrogen with a methyl group, then we get polypropylene, which is this flexible and soft material that we can spin into fibers. So the personal protective equipment, the PPE, right now is in shortage in a lot of hospitals. They are mostly made of polypropylene. Again, very different properties from PVC or PE simply by a small change on the molecular structure. So in my group, we're trying to use polymers to solve healthcare problems. And this example I wanted to chat with you about is the treatment of otitis media. So otitis media is just a fancy word for medullary infections, which I'm sure many of you have had in the past. In fact, almost every single child in the US has had at least 1 episode of otitis media, as shown in the statistics here. And about 1/3 of you could actually have more than 6 episodes of otitis media or medullary infection by the age of 7. And that is perhaps why otitis media is the #1 reason for children in US to receive antibiotics, to take antibiotics. And otitis media alone is responsible for more than 20%, more than 1/5 of all the antibiotic prescriptions written to US children. And the problem is even worse around the world. In most developing countries like China, it's my hometown where I'm from, otitis media is usually not treated or diagnosed even, which could lead to intracranial complications and a pretty significant mortality rate of over 20,000 every year. Unfortunately, our current treatment options for this extremely common pediatric infection is very limited. We basically rely on oral antibiotics for 5 to 10 days if you get a medullary infection. And what that means is that parents will have to force feed their suffering children 3 times a day for an entire week. And once taken, the drug has to go through their entire bodies to get to the middle ear, this tiny space of about 1 centimeter across, in order to treat the infections. Along the way, these antibiotics can cause many side effects in more than 50% of US children. And maybe many of you might have experienced these side effects like rashes, vomiting, diarrhea. And more recently, research has linked this early exposure to antibiotics to health issues later in life, such as asthma and obesity. Perhaps most importantly, the systemic application of antibiotics for such a prevalent disease is believed to breed antibiotic resistance, which we all know is a serious public health concern. So in my group, we came up with a solution to all of these problems. And the idea is that a pediatrician in the doctor's office, upon diagnosis of otitis media, would deliver a single dose of antibiotics directly onto the eardrum. And this direct transport of the drug into the middle ear, where the infections are, would obviate all the above mentioned problems. However, this is currently believed to be impossible because of the extremely impermeable nature of the eardrum, the tympanic membrane here. So this tympanic membrane is only about 10 microns thick in humans. So it's about the thickness of your hair. It's extremely thin, but it doesn't allow any molecules to go across. That kind of makes sense, right? If you go swimming, it's this thin layer of cells that prevents water from going into your middle ear, which could cause serious troubles. So that is why we designed this distinct drug delivery platform to realize this. And a crucial and practical feature of the system and is this hydrogel, shown as a blue liquid in here. So what's special about this hydrogel made of polymers is that it's an easy to apply solution under room temperature, so you can squirt it onto your eardrum really quickly. But once it contacts the warm tympanic membrane, the warm eardrum, it quickly solidifies into a solid gel. And it is this solid gel that continuously deliver antibiotics across the thin eardrum, thin yet impermeable eardrum, allowing antibiotics to go across into the middle ear and eradicate infections. And this property of staying a liquid under lower temperature, but solidifies under higher temperature is quite the opposite of what we're familiar with on our daily basis, right? For example, water is a liquid under higher temperature, but it freezes if you reduce the temperature. Whereas in this case, the solidification is really occurs as you increase the temperature in the opposite direction of temperature change. So that is why this behavior of the polymer system is called reverse thermogellation. It's quite a unique behavior for this type of materials. And as I just mentioned, there are three components to this treatment: the therapeutic, which is antibiotics, the chemical permeation enhancers, which are the secret sauce, if you will, that brings the antibiotics across the eardrum and into the middle ear to overcome that impermeable eardrum. And finally, a thermosensitive hydrogel that we designed to accommodate, to encapsulate all of these different components and to ensure the long-lasting effect of this therapeutic system. So for the therapeutic, for the antibiotic, we chose ciprofloxacin, the one highlighted here, because it is small in terms of molecular weight, and it is moderately hydrophobic, as indicated by this log P value here. That's why we expect good permeability of ciprofloxacin across eardrums. And that transport of drug across the eardrum is further enhanced by the chemical permeation enhancers. So limonene and SDS are both potent and non-irritating CPEs, chemical permeation enhancers, that have been approved by the FDA for topical applications, like the one we're doing here. And bupivacaine here is a local anesthetic. In this case, it not only stops the pain, so our patients stop crying right away, but it also boosts the permeation enhancement of limonene and SDS. And finally, everything is loaded into this polymer matrix, which has this temperature responsiveness. As we increase the temperature, it solidifies into a gel that stays on the eardrum and delivers the entire course of regimen. So impressively, we tested this therapeutic platform in a chinchilla animal model and proved that indeed we can get very high concentration of antibiotics in the middle ear space. And here on the y-axis, we have the drug concentration in the middle ear. And this red dotted line on the bottom here is what is required to eradicate the infection. And as you can see, just by administering one time this treatment platform, we can sustain therapeutic drug level in the middle ear throughout this entire 7-day treatment. And at any point, the drug concentration is several orders of magnitude greater than what is required. So it is very effective. And this also compares favorably to our common oral antibiotic therapy. And in this case, in our experiment, the oral administration caused a really low drug concentration in the middle ear because it's administered systemically and the drug had to travel all through your body in order to get to the final destination. And this 1 microgram per mil concentration would be all the way down here that we couldn't even see it. So that is why we observed a very rapid response to this treatment once we give it to animals that had this infection. So in this case, chinchillas are an ideal animal model for middle ear infections because they have big ears. It's anatomically easily accessible, but also you may not know this, chinchillas get sick from all the human pathogens that cause middle ear infections. So the 2 bacteria that we tested here, the non-typable Haemophilus influenzae and the Streptococcus pneumoniae, they're collected from real pediatric patients, from children with middle ear infections, and used to induce otitis media in chinchillas. And as you can see from this plot, we were able to treat 100% of the infected animals within the 7-day treatment. And these 2 bacteria combined actually account for more than 60% of all the middle ear infection cases in the US. So chances are you might have had one of these bacteria when you had your middle ear infections. And this potent formulation also has excellent biocompatibility. So here we're looking at the cross section, so the side view of your eardrum, and you can see it's very thin, it's only about 10 microns thick. And these are eardrums that were treated using different approaches. So on the right, these 2 panels show you the eardrum treated with this hydrogel formulation in health or in disease. And you can see the eardrums look almost identical to the pristine ones on the upper left corner here, in health or in disease. So there's no inflammation or necrosis or any other type of tissue damages. And we have also shown that this hydrogel could degrade automatically after 3 weeks. So you don't have to pay an extra visit to the doctor's office to get it removed. And because you have this physical gel on your eardrum, it does have a mild effect on hearing sensitivity, as we measured using this approach called auditory brainstem response testing. But this effect is really mild compared to the type of hearing loss, temporary hearing loss that you experience during an active episode of infection. And you may recall at the beginning of the talk, I made much of the need of avoiding systemic antibiotic exposure. So to prove that this local treatment indeed avoided the systemic drug distribution, we measured the blood level of ciprofloxacin, the antibiotic that we used, in animals that are infected and treated at different time points. And as you can see from this table, the drug was undetectable at any time point, despite being super therapeutic in the middle ear space. And that's all that I have to chat with you about polymers and how we use it to treat infections. And this is the list of wonderful people that I've worked with that made this research a reality. And right now we are collaborating with Boston Children's Hospital to push this treatment forward, hopefully into clinical practice one day. And with that, I'd like to thank you for your attention. And if you have any questions, I'll be happy to answer that. Thank you.
Thank you so much, Dr. Yang. That was a great talk. Oh,
Thank you.
I didn't know that the pills we take are coated with this polymers. That's interesting.
Yeah, it's really common nowadays. I know it is true for, I know it's true for Adderall. There's a sustained release version and there's the instantaneous version. And it's true for many different drugs too.
Wow.
Yeah.
Okay. So I'm Sana. So I'll be asking some of the questions that our audience has for you. And Anushka asks, are there any side effects of the Matrigel treatment?
The side effects for the hydrogel treatment?
Right.
We haven't seen any side effects so far because there's just no systemic distribution. So the drug doesn't even touch your gut microbiome. It doesn't even enter your stomach. So that's how we avoided a lot of the side effects.
Wow. Okay. So so localized. That's very cool.
Exactly.
Okay. And then let's see. Oh, Mara is asking, in general, what does the process of translating research like this into an approved medical treatment look like?
That's a great question. So that's what we are trying to figure out right now. So it really depends. So for things like this, it's in a bit of a gray area because it could be viewed as a medical device versus, because nothing really enters your body. It just sits on your eardrum. So in that case, it's a bit shorter. It's about 2 to 5 years of clinical trial. But for most of the therapeutics, cancer drug, antibiotics that we take, or antibiotics, it's a pretty long route. So you have to go through phase 1 to 3 clinical trial to prove safety, efficacy, and applicability. So it's a long
a long process, even when, oh, wow. Okay. Okay, let's see. I think we have time for one more question. And I guess this could be a little more on the personal side, because Margot is asking, how did you get started with polymers? And then when you got started becoming interested in polymers, how old were you?
So I heard about polymers when I was in, I think I was in high school, and I just thought it was really fascinating, but I really didn't know much. I'm just like, oh, plastic. Interesting. It's light. And I really got into the research of polymers, or got thinking about polymers when I was in college. I remember going to a talk, and the presenter was talking about how exactly of what I said today, how they changed just the molecular structure slightly, and that give them a completely different line of product. And that's when I decided to pursue research in polymers for my PhD.
Wow, that's fascinating. Yeah, just one talk can just influence someone in such a great way.
I think I think things like conferences like this is really helpful because you get the exposure to so many different topics, and then one of them might really resonate with you.
Well, thank you so much for the great talk. We have more questions, but then due to time limits, maybe you could answer them in a Q&A chat.
Definitely.
We loved having you. Thank you so much.
Thank you guys for organizing this wonderful event.
Thank you. Okay, back to you, Barrett.
Thank you, Rong, for that talk. That was so interesting and so cool. And we had a lot of discussions going on. Someone said, oh, I'm gonna text my mom right now. I always had ear infections as a kid. I wonder if this is what's going on. So it's so cool that we get to actually experience the conference this year, which we are just loving, and hopefully all the participants, while judging by their Q&A, they're loving too. So it's really awesome to see everything that's going on. It's just so cool. So thank you so much for that talk, and hopefully, you can respond to some of the Q&As in the chat there.